Chiropractic and Immunity, A Crossroads, Part 2. In Part 1 of this presentation, we covered what is known to date regarding the literature support for chiropractic manipulation and immunity. We left with the discussion of the Haavik et al. Publication, The Potential Mechanisms of High-Velocity, Low-Amplitude, Controlled Vertebral Thrusts on Neuroimmune Function, a Narrative Review. In their summary, they stated, quote, "However, it is not yet known whether HVLA-controlled vertebral thrusts have a clinically relevant impact on immunity. Further research is needed to explore the clinical impact of HVLA-controlled vertebral thrusts on immune function," unquote. They go on to state, though, that chiropractors and other manual therapists should be aware that clinically relevant research has not yet been done that shows that HVLA-controlled vertebral thrusts enhance immune function. This is important for all manual therapists to know when promoting the potential benefits of HVLA-controlled vertebral thrusts or when sharing information related to HVLA-controlled vertebral thrusts and immunity or the COVID-19 pandemic, unquote. However, what follows could be interpreted as almost a contradiction to these statements. The weight of this publication is the proposed mechanisms by which manipulation could influence immunity. And throughout this review of hypothetical connections, clarification is often necessary. They use the words possible, likely, or probable often, again potentially misleading to those who want to believe that clinical evidence exists. At the beginning of their article, they state, quote, "The COVID-19 pandemic has resulted in significant global morbidity and mortality, especially amongst individuals who are immunocompromised, such as older people and those with underlying medical conditions." But they go on to state, quote, "One such healthcare modality that has been shown to influence neuroimmune chemical concentrations over the last 2 decades is manual or mechanically assisted application of specific HVLA-controlled vertebral thrusts, also known as chiropractic adjustments or spinal manipulation." Let's stop here. If they're implying a substitution of chiropractic or addition to boost neuroimmunity, is this claiming to be as effective as a vaccine? Is it this simple? Chiropractic affects the central nervous system. The central nervous system is involved with the immune system. Therefore, chiropractic improves immune function. What should be obvious from the beginning of the discussion is that research evidence is based on a predetermined outcome measure. In other words, what's a measure for immune function improvement from chiropractic treatment or any treatment? If the proposition is that you are affecting the immune system through affecting the central nervous system, which seems to be the proposition, then do you measure CNS function? And if it changes, you can assume that immune function changes. And if that's true, why is the assumption that it's positive? Doesn't immune function also go awry with autoimmune disorders, anaphylaxis, etc.? Isn't immune function measured by testing for levels of an infectious agent or the antibody response to that? And isn't the adaptive system specific to that organism? And for innate immune function, can you measure any single component, such as interleukin-2, and determine that there is a positive effect? So regarding affecting the central nervous system, we're not alone. Here we see that acupuncture affects the central nervous system, as illustrated by functional MRI. And here we see that phantom acupuncture induces a placebo effect that also is measured on functional MRI in low back pain patients. And here we see that massage has a similar effect. So in summary, the immune system reacts to what is determined to be foreign. Assisting in that response is a complex interaction among the nervous system, hormones, and a number of metabolic processes, and complicating this is the interaction in responses with pain and stress. So is it that simply affecting the central nervous system therefore equals a positive effect on the immune system? So here's the problem with oversimplification and assumptions. Generalizability. Can we assume that because California has people, cities, local government, and that given there are connections among its cities and people, that if we study one city, we can generalize to all cities or states? Are all cities operationally similar? Are all people of like mind with regard to reactions to the same information? Do all individuals do one job? Do their roles change with context, such as parent, citizen, employee, etc.? This is also true of the central nervous system. This is a diagram from Dr. Haavik's article, which shows just how complex and interactive immune function is as it relates to the central nervous system. Given the complexity of the immune system and response, how do you measure a beneficial immune effect? If the central nervous system is stimulated by manipulation, how strong is that effect and how is that measured and compared? If manipulation affects the central nervous system, again, how long does that effect last? And with regard to central nervous system stimulation, is the effect more from decreasing pain, which results in neurochemical change, or is it the neurochemical change that affects pain or immune function? From Haavik's article, quote, "The mechanisms are most likely due to the known changes in proprioceptive processing that occur within the central nervous system, in particular within the prefrontal cortex following HVLA spinal thrusts," unquote. The prefrontal cortex is not one structure, but is made up of multiple subsections, each with its own multiple functions as it relates to other neural stimulations. These circuits change based on the stimulus and the context. This functional connectivity has not been sufficiently mapped out to be predictive of what happens with any specific stimulation. Here are some examples of the multiple divisions and functions of parts of the prefrontal cortex, and an example of the complexity of autonomic regulation of emotions. So the concerns being voiced about chiropractic claims and immunity extend from students, researchers, and this has been documented through social media tracking. So is it enough to establish the historical relationship between chiropractic and neural function and assume that because we focus on the nervous system and the nervous system and immune system are interrelated, that there is a normative effect using manipulation, and that this must also occur in symptomatic patients who have yet to be studied? Let's take a look at some postings on social media. Here's one, Chiropractic Care in the Immune System, which quotes a study that was never published related to the 1918 flu epidemic in the United States. We see two references, but these are actually not the studies. These are where the studies are quoted, even though they've never been published. They go on to state, by removing the nervous system dysfunction, spinal adjustments can help improve immune system function. But yet again, these two references are not the references referred to from the 1918 flu epidemic and have nothing to do with studying immune function through scientific study. Here's another. Did you know spinal adjustive care increases immunity and decreases risk of infections? Go to the chiropractor. Look closely, though. This was published in the Journal of the Osteopathic Association. And here's a summary of that study, demonstrating that this is not in fact manipulation, but lymphatic massage. And here's yet another, Chiropractic and Immunity. A chiropractic adjustment was proven by research to improve a specific immune-binding protein called interleukin-2. Some of the most harmful and fatal diseases plaguing millions of people today are related to lowered immunity. Chiropractic adjustments uniquely improve immunity for infants, children, and adults by removing interference in the nervous system. The study being referred to here was a small study demonstrating some increases in interleukin-2-induced IgG and IgM synthesis. However, the researchers state, the amount did not exceed the physiological range of normal human response. The authors state, the clinical significance of the elevated responsiveness of interleukin-2 demonstrated in this in vitro study is presently unclear. Interestingly enough, this study found a short-term increase with spinal manipulation, whether there was cavitation or not. This posting states chiropractic and ear infections 93% improved, 75% in 10 days or less, 43% with 1 or 2 treatments. And this was published in the Journal of Manipulative and Physiological Therapeutics. This was a survey that was done with parents in a private practitioner's office. They state that it was unclear what the natural history is for resolution of ear infection. Yet, In this review, Natural History of Untreated Otitis Media, we find they do know. In their review, they determined that acute otitis media's symptoms improved within 24 hours without antibiotics in 61% of children, rising to 80% by 2 to 3 days. If we compare this to the study on chiropractic, natural history actually beats chiropractic. This is the problem with observation and no comparison. So the question is, will you make statements to patients about a boost in immune function with chiropractic care based on your observation of your patients and state that there is evidence, or will you state the truth about the evidence, which is that it is your observation only, and that there are no studies that have compared those who were treated versus those who are not to determine whether with manipulation there is either less incidence or more incidence of that disease, and confirm this objectively through detection of the infectious agent or antibodies to that agent. It is an ethical crossroads you cannot avoid. The results impact not only you, but your patients and their families, and could potentially be life-threatening if patients substitute a chiropractic adjustment for the proven effectiveness of vaccines.